An estimated 1 in 5 school-age children struggle with mental health. 80% of those students do not receive professional help. That's according to Wisconsin Governor Scott Walker's latest budget proposal. In tonight's Assignment Education report, Lisa Klein tells us how the governor hopes to allocate more money to mental health care needs in the state's public schools.
Martha, Governor Walker's budget proposal gives $6.5 million to different mental health needs in public schools. The money would go towards social worker expenses, grants connecting kids to mental health services, and additional mental health training. Tonight, I will show you how the mental health needs of our current student population may be impacting classrooms and teaching across the state, and how additional resources could help.
Question.
If you ask any teacher why they chose education as a profession, you will most likely hear a similar response.
I've always been that person that wants to help everyone and take care of everyone, and so it just seemed like a natural profession to go into.
Mrs. Elston has been an educator for 15 years.
7.
In the past 5, she said she's noticed a change in student behavior.
When I first started teaching, it was a lot of just we're teaching and not necessarily dealing with a lot of those things that they were bringing in, the explosive behavior or the sadness. Raise your hand, please.
This type of behavior, along with mental health issues, some say is a factor in the changes seen in classrooms throughout Wisconsin.
It's really probably one of the #1 issues in the district right now in terms of needs in buildings, issues that are brought forward. It just seems like it's a growing trend where we have more and more students who have more and more mental health needs, which definitely has an effect in the buildings.
But while mental health is a concern in Wisconsin classrooms, 15 years of data shows the number of students identified with the educational diagnosis of an emotional behavioral disability is steadily decreasing.
While we may not be seeing a growth in numbers, we're definitely seeing students that have needs that just have a lot more complexity to them.
The complex needs of the school-based EBD diagnosis, combined with both clinically diagnosed and undiagnosed mental health issues among students, could be a factor in disruptive classroom behavior.
What I hear from the staff that evaluate and serve these students is that there's a lot more trauma in students' backgrounds that is impacting their needs at school, in addition to a lot more mental health diagnoses that are happening at the same time as these educational diagnoses of an emotional behavior disability.
The Director of Pupil Services and Learning Supports says her district provides school counselors, social workers, and school psychologists to help students and classroom teachers with mental health support.
All of our elementary schools have a full-time counselor or social worker, and they collaborate with their colleagues.
Adequate mental health staffing has been a priority for the district, despite budget cuts in education.
For instance, right now our percentage or our ratio of counselors and social workers to student is really essentially what it was 10 or 15 years ago, even before there were cuts.
But despite steady levels of mental health staff, the complexity of the cases is creating a demand for more help.
We have excellent special education teachers that work with students with emotional behavior disabilities, amongst other things. But when you have complex needs, their ability to support their entire caseload may be impacted with, they may be spending a lot of time working with 1 or 2 students with significant needs, and that makes it hard for them to meet the needs of all their students. I think we just see people being stretched thinner and thinner.
District leaders say the additional mental health funding proposed by Governor Walker to support teachers and students could be very beneficial.
Just to recognize that we maybe don't have as much help as we would like to have, so certainly some help from the state and some positions funded that we might be able to tap into resources would be wonderful for us.
In the ideal world, for example, at our elementary buildings, I'd have a full-time counselor and a full-time social worker in every building. That counselor could work on classroom guidance kind of from the universal level and working with all students and groups, and that social worker would be working with families and working one-to-one with students quite a bit, delivering services, as well as our school psychologists.
I want to compliment you.
For classroom teachers like Mrs. Elston, the additional resources proposed by the governor are vital.
Whatever resources we can use to get our students and our parents and our teachers in the best place that they can be to learn and to teach and to help each other, will improve the classroom performance.
which will allow teachers to focus more on why they entered the profession, to care for and educate our children.
The end.
If the governor's proposed state budget is passed, $6.5 million will be spent on mental health needs for public school districts and independent charter schools.
Now, when it comes to the La Crosse School District, they said they've been using several different types of strategies to help kids if they have mental health issues or EBD needs, right?
That's exactly right. They said they have more than 100 trained staff to work with students who are in a crisis situation. They also pointed out that they collaborate with mental health experts throughout the community who volunteer their time between 10 or 60 minutes a month with almost every school in the school district.
All right, thank you very much, Lisa, with that report.